Hi, my name is Shelbi Sexton, and the title of my research is Can You Hear the Difference? Focused Auditory Stimulation, the Impact on Discrimination and Production of Single-Word Targets. So first I wanted to define what focused auditory stimulation is. It was formerly known as auditory bombardment, which is a component of the Hodson cycles approach. This typically involves a subject listening to amplified target words through headphones or speakers, which provides intensified, repeated exposure to phonological or articulation targets. For the remainder of this presentation, I will be referring to focused auditory stimulation as FAS. So first, a phonological disorder is defined as when a child does not produce speech sounds necessary for his or her age. Phonological disorders are diagnosed as the most common type of speech impairment in preschool and school-age children. These children are prone to having limited grammatical and vocabulary abilities, which are imperative to developing a child's knowledge at an early academic level. The cycles approach is a method of treatment that is commonly used with these children, but current research on the component of FAS lacks clarity and quantitative data. This lack of data does not currently demonstrate if FAS is beneficial to patients with a phonological disorder. The cycles approach, along with FAS, is often used in correcting speech sound productions, which can later lead to improvement in the child's language skills. However, research studies that have used auditory discrimination and articulation production still proves to be inconclusive and methodologically questionable. The purpose of my study was to determine if FAS is an effective component of the cycles approach for a child with a phonological disorder. My research study proposed two questions. First, does FAS of single words presented via speakers prior to and following treatment cause an increase in correcting single word productions? And secondly, does FAS of single words presented via speakers increase auditory accuracy of discriminating sounds in minimal pair contrast? The original cycles approach has been modified to be called the Cycles Phonological Remediation Approach, or CPRA, which focuses more on FAS, experiential play, and phonological awareness. However, current research has not implemented these CPRA procedures in exactly the same way. For example, Almost and Rosenbaum modified the CPRA to include minimal pairs and phoneme practice from the single word to the conversational level. Other researchers, such as Tyler, included FAS without amplification and practice at the word sentence level. The results of prior studies indicated that these children made significant improvement, but variables other than FAS may have contributed to these significant gains. The original study by Hodson and Padden that used FAS lacked quantitative data and had more substantial amounts of qualitative information that was not measurable. Preceding research studies have used the modified cycles approach with the component of FAS, which illustrated improvements in articulation. However, the researchers did not control variables which could have led to the direct impact on reduction of phonological patterns. Also, evidence of significant gains in phonological errors could have been attributed to not counterbalancing the effects of treatment. My experiment consisted of quantitative data and was an alternating simultaneous treatment design. The A phases consisted of baseline, and the B phase consisted of Artic drill therapy alone. The C phase consisted of Artic drill therapy with FAS. These therapy sessions consisted of targeting one letter sound in using either articulation drill therapy or articulation drill therapy with FAS. Also, treatments of B and C were switched each therapy session to counterbalance the effects of these implemented treatments. My study consisted of a single subject. He was 4 years old with a moderate phonological disorder, and research was conducted in two different testing locations, at the Animush Rock or the subject's home. It was conducted 5 days a week for 50 to 60 minutes and over a 4-week allotment. My materials consisted of the GIFT of 3, the CTOP 2, and the TAPS 3. The GIFT of 3 was to measure his current articulation abilities. The CTOP 2 was used to assess phonological awareness, phonological memory, and rapid naming, and the TAPS 3 was to assess his auditory discrimination skills. Also, percentage of correct response was measured for the sounds that would be targeted during the therapy session. Also, a hearing screening was conducted prior to assess that auditory skills were within normal limits. So during each therapy session, I used a JBL speaker that had the pre-recorded FAS sounds on it. I used a decibel meter that measured the sounds at a conversational level of 50 to 60 dB, and minimal pair worksheets were used to measure his auditory discrimination skills. Again, the subject was pre-tested and post-tested using the 3 assessments presented previously. So this is just a breakdown of a therapy session. So typically during the first 30 minutes of a session, we would target just using Arctic drill therapy, in which we would target one letter sound in either imitation, isolation, or syllables or single words. Then during the second 30 minutes of the session, the child would listen to 15 CBC words presented from a speaker. Then we would target another letter sound with Arctic drill therapy, again in either imitation, isolation, a syllable, or a single CBC word. Then the child was given 15 minimal pair words in which he has to identify if they were the same or different. And lastly, before he left, 15 CBC words again were presented via speaker. So an ANOVA for repeated measures was used to examine the differences before and after treatment. I took 2 composite scores from each of the 3 assessments to measure production errors and auditory accuracy skills. The ANOVA indicated no significant differences in his articulation, phonological memory, or phonological awareness when given FAS. So percentage of correct response was baseline before and after therapy was implemented to demonstrate changes in his accuracy of productions. I used 3 separate t-tests to examine the mean differences in percentage of correct response. The results of the correlated t-test did demonstrate significant improvements in the initial and final position of single words, with or without being given FAS. Auditory discrimination was measured by the 15 CBC words that were given after Arctic drill therapy and FAS was implemented. As you can see, there were no significant improvements demonstrated in the area of auditory discrimination. Percentage of correct response was also calculated after each therapy session to measure the child's daily accuracy of productions. As you can see, no significant differences in percentage of correct response across all variables, with or without FAS, was demonstrated. Limitations of the research were testing threats of employing pre-test and post-test measures in a short time frame. Testing threats could have resulted in my subject demonstrating improvement in his standard scores during the second administration. Also, the 4-week allotment might not have been enough time to show statistically significant results. So my recommendation would be a longer time frame. Another limitation is my small sample size. I did use 1 subject, which definitely limits my generalizability, so my recommendation would be to use a larger sample. Another limitation was poor inter-rater reliability. It was only 10% due to having technical difficulties with my audio and video recordings. So recommendation would be a greater measurement or several inter-raters that would be beneficial to improve my inter-rater reliability. Another limitation was the percentage of improvement in FAS, which could have been attributed to chance because the subject did have a 50-50 chance of identifying if the word was the same or different. So a recommendation would be a better measurement of auditory discrimination. And lastly, the age of the subject could have been a factor in terms of attention and comprehension of identifying minimal pairs. So a recommendation would be to use several different age groups. So in conclusion, to answer my first question, the results of the research study indicated that FAS presented for a speaker does not have a significant effect on auditory discrimination of single word productions. To answer my second question, does FAS of single words presented via speakers increase auditory discrimination when discriminating sounds in minimal pair contrast? Again, it was not effective in increasing auditory discrimination skills. Also, with my study, incidental results of the study did demonstrate that the implementation of focused auditory stimulation, along with Arctic drill therapy, can increase accuracy of single word productions. Also, further research is still needed to demonstrate if FAS is an effective intervention component to the cycles approach. The implementation of FAS along with drill therapy still needs further investigation to isolate the effects of both treatments. These are my references.